This presentation will be covering insomnia. I'm Bethany Von Hoff, and I will be the presenter today. This presentation will cover a general description and classification of insomnia, as well as ways to treat insomnia, including lifestyle modifications and pharmaceutical options. There are several ways to classify and define insomnia. Insomnia broadly is difficulty sleeping or not getting enough sleep. The first big distinction is between people who have trouble falling asleep and people who have trouble staying asleep throughout the night. The second classification is how long the insomnia is lasting. It's considered transient if it's only for a few days, acute insomnia if it's less than a few weeks, and chronic insomnia if it's lasting 3 or more nights a week over a 1-month period. Finally, there are two classifications of the causes of insomnia. Primary insomnia is insomnia that is not caused by another medical condition or medications. Secondary insomnia is insomnia that is caused by something else, specifically a medical condition, medication, or other sleep disorder. So again, primary insomnia is when insomnia is predominantly the cause and problem of the insomnia. So this insomnia may be triggered by stress or emotional upset, or travel where you may be changing time zones, or your sleep may be interrupted because of something temporary like noise or construction. And bad habits can lead to primary insomnia. So this is when the biggest concern is the insomnia. We'll talk about some of these habits later in the presentation of what can trigger insomnia. Secondary insomnia means that insomnia is secondary to something else. So this might be from depression, anxiety, alcohol, caffeine, restless leg syndrome, medications, and a few other things. As you can see from this slide, depression, anxiety, alcohol, and caffeine are the most common causes of insomnia. Certain people are at a greater risk for developing insomnia over others. Women appear to develop insomnia more frequently. This may be due to changes in hormones and neurochemicals that fluctuate throughout a woman's normal menstrual cycle and during menopause. Additionally, older adults, especially people under a lot of stress and those who work nights or work shift work, can have a higher risk of developing insomnia. And then also patients who are in a lower socioeconomic class are at a higher risk of being affected by insomnia. Signs and symptoms of insomnia include taking too long to fall asleep, lying awake for long periods of time, staying asleep for only short periods of time instead of throughout the full night, or waking up early or waking up feeling fatigued, irritable, or anxious during the day, or having trouble concentrating during the day due to poor or inadequate sleep. Let's take a second to pause to reflect on the risk factors we talked about for insomnia. Which of the following is a risk factor for developing insomnia? If you aren't sure of your answer, please pause the video and review your notes. Insomnia is incredibly common, and even though it's very common to joke about never having enough sleep or always being tired or needing coffee, insomnia has serious consequences and should be taken seriously. Over half of young adults wake up feeling unrefreshed, and over half of young adults postpone sleep to get more done. A lot of insomnia may be due to our lifestyle choices. Not getting enough sleep and insomnia can impact the immune system and can have physiological consequences, as well as other serious consequences such as car crashes and accidents. There are several complications of insomnia. Beyond just feeling tired or having trouble thinking the next day, you are at an increased risk of being obese, you're at an increased risk for diabetes and hypertension, and also you put your immune system at risk. And insomnia also puts you at an increased risk for substance abuse such as alcohol. As mentioned before, your habits and lifestyle can play a huge role in managing insomnia and increasing sleep quality. We call these habits sleep hygiene. These are things that patients can do on their own to improve their sleep. If patients can follow this advice in a consistent manner, many patients can reduce or control the insomnia. For many patients, sleep hygiene isn't always enough, but it still can have dramatic improvement. Proper sleep hygiene includes things such as using the bed in the bedroom only for sleep. When you use the bed for things like reading or watching TV, it tells your brain that the bed isn't just a place for sleep. You also want to limit bright lights and lights from computers and TVs close to bedtime. And you should also try to go to bed and wake up around the same time of day so your body can get into a routine. If these lifestyle modifications and sleep hygiene aren't enough, there are medications that patients can take. They fall into several different types of classes. The over-the-counter options such as melatonin and antihistamines are good choices for transient insomnia. But if the insomnia is more severe or chronic, we have other prescription options. Antihistamines are a common over-the-counter medication used for sleep. If you remember back to the allergies and allergic rhinitis presentation, not all antihistamines make people drowsy though. So for the use of insomnia, we usually consider diphenhydramine or Benadryl or doxalamine, which is also in Unisom. With these medications, patients may still feel drowsy the next day. Using these medications are recommended for short-term episodes. For example, if a patient is traveling and is out of their normal routine, or a lot of times if someone is sick or getting over an illness or cold and they feel like they're having trouble sleeping because of the cold, sometimes I'll recommend using one of these OTC options just so they can get a full night's sleep to help their body recover faster. These are not recommended for chronic use because patients can become tolerant to the sedation and they lose efficacy over time. Also, they are not recommended for long-term use because of that potential for the hangover effect or the drowsiness the next day. Also, if you remember from the allergy presentation, antihistamines are not really recommended in the elderly because of the increased fall risk and because of the anticholinergic side effects. Using antihistamines in combination products for sleep is incredibly common. Even though we said that using antihistamines can sometimes be appropriate for short-term use, a lot of people don't realize what's in these PM products that's making them sleepy, and they think it's okay to take them for long-term use. So it can be really important to ask patients who are taking products like Tylenol PM or Advil PM if they are having pain at bedtime and that's why they're taking it, or if they really are just taking it for sleep. If they're just taking it for sleep, they may be unnecessarily taking the Tylenol or ibuprofen. And as we've talked about in other presentations, even though Tylenol and ibuprofen are over the counter, they can have drug interactions and also drug disease interactions and can be unsafe for patients with kidney or liver disease. Also, some of these products can charge a lot of money for something as basic as an antihistamine. So for example, ZQuil right in the middle is actually just liquid Benadryl or diphenhydramine. So when I talk to patients if why they are taking this and how long they're taking it, if it's still determined that using an antihistamine is appropriate for them, I really just encourage patients to use regular Benadryl or diphenhydramine rather than paying for the name brand on some of these products. Melatonin is a naturally occurring hormone that helps regulate our normal circadian rhythm. It helps to promote falling asleep. Even though there's established evidence for melatonin, there are still some concerns as it is sold as a dietary supplement. So as we've talked about before, it's always important to choose dietary supplements that are from reputable sources that follow good manufacturing procedures. Also, because it is a dietary supplement, it is not regulated by the FDA. And there are also no specific studies of long-term use, but melatonin is recommended in several guidelines and can be an appropriate recommendation, especially in situations where the circadian rhythm might be off, like jet lag and traveling. The last non-prescription option we will talk about are herbals. There are some herbal products that have claims to improve sleep quality, but they are not well studied and the effectiveness and safety is not well established. As always, even though it's an herbal product, it can still have drug-drug interactions or drug disease interactions. So a great resource before starting an herbal product is to check with a pharmacist for guidance on the appropriateness of starting an herbal supplement. Next, we'll transition into prescription products. Again, these are for patients with more severe or chronic insomnia, for whom lifestyle modifications and OTC products are not sufficient in alleviating insomnia. The most commonly used medications are in a class called the non-barbiturate hypnotics, or these may be referred to benzodiazepine-like medications. There really isn't a good classification for these type of medications, but they mostly work in similar ways. This class of medication binds to the benzodiazepine receptor subunit. This is the same receptor that medications like Valium and Xanax bind to, but the binding of these medications used for insomnia doesn't cause the full expression like benzodiazepines, but does result in the intended sedative effects. These medications are controlled Schedule IV medications because there is risk for abuse or addiction. The common side effects are dizziness and drowsiness, and it's very important to not take these medications with alcohol, which we will talk about in the next slide. As the use of these medications became more popular, there were some side effects noticed by the FDA and some warnings were put out. One of the risks was that along with the sedation and relaxation, there can be a relaxation of the throat, which can lead a patient to stop breathing. They also noticed an increased risk of an allergic reaction, specifically an angioedema type reaction, in which there's swelling of the face and lips that can close off the airways. Also noted with these medications is that some patients will perform activities while they're sleeping, like eating or driving, and they'll do this while they're sleeping and they'll wake up with kind of an amnesia and they won't remember doing this until they go down to their fridge and see that a bunch of food is gone. This kind of sleep habit or doing things in your sleep is especially worse when the medications are combined with alcohol. So doing things in your sleep can be very dangerous, so adding alcohol is an especial concern with these medications. This slide includes a list of the common agents that fall into this category and the recommendations around their use. You'll see that a lot of them have recommended lengths for how long they should be used, but in practice you will see people who are on these agents chronically for longer periods of time. However, we'd prefer if patients were continuing to try lifestyle modifications and using medications only for short-term basis as needed. Another warning you'll notice for Ambien, and this also goes for the Ambien extended release, is that it's recommended for women to start at lower doses. This warning and recommendation came out of the FDA in 2013 that women were still having daytime or morning effects from the medication because it was not clearing their body as quickly as it does in men. This was leading to accidents or women still in a sleep-like state when they were waking. Therefore, it's recommended that women start on the lower doses and only go up if necessary and if they are not experiencing any of these morning side effects. This next medication, Belsomra, falls under the same category as the non-barbiturate hypnotics, but it works in a much different way than the other medications in this class. This medication does not act at the benzodiazepine receptor, but rather it acts to block the orexin receptor. And orexin is a neuropeptide that regulates the wakefulness. So when this receptor is blocked, there's a suppression of the wake drive, which leads to sleep. Because this medication is working by inhibiting wakefulness, it doesn't actually cause the sedation or the drowsy feeling that most of the other medications cause for insomnia. So it's very important to tell patients who take this medication that it won't feel like other medications they may have tried, or it won't give them that same feeling that they think they might be expecting. Another important warning with this medication is that patients should not take it if they cannot get at least a full 7 hours of sleep. As you can see, this medication has a longer half-life than some of the other medications, so this can lead to significant daytime drowsiness if it's taken without a full 7 hours of sleep. This next medication is in a class of its own as well. Rozarem or Ramelteon is a prescription medication that actually works on the melatonin receptor, and it acts like melatonin to maintain the normal circadian rhythm. So again, it works to help put people fall asleep faster. This medication is not a scheduled medication and is not shown to have any issues of abuse or addiction like some of the other medications that we've talked about. However, even though this is mimicking a natural hormone, there is some side effects related to how it acts. This medication can cause significant nausea, and it also has the potential to change prolactin levels in adults and children. This change in prolactin levels is mostly a concern for children because we have concerns about their normal development through puberty. Therefore, it's usually recommended that if children are on this medication, that they stop at the onset of puberty. We are not sure yet of the consequences in adults of long-term use, and that is still being monitored. Lastly, we will talk about benzodiazepines. These include agents like Valium and Xanax. These used to be used quite frequently for insomnia, but now they are not really used or recommended for insomnia except for very short-term treatment. There's a high risk of addiction and abuse with chronic use, and if someone discontinues using these suddenly, they are at a high risk for seizures and other problems. Also, this medication in combination with alcohol can cause someone to stop breathing, which is obviously a dangerous side effect. There is a table with some of the medications in the benzodiazepine class that can be used for insomnia, but in general, we try to stay away from these medications for traditional insomnia because of the risks and side effects. Again, take a second to answer this review question. If you're having trouble answering, please review your slides. So it's asking you to complete the sentence below. Bromeltian works for insomnia characterized by people who have trouble falling asleep, poor quality of sleep, frequent awakening, or early morning awakening. So in conclusion, to wrap up this presentation, insomnia is very common and the consequences go beyond just feeling tired and fatigued. There can be real physiological consequences with lack of sleep. The first step in insomnia is to practice good sleep hygiene, and this is effective for most patients. But if this doesn't work, know that we have OTC options as well as several options of prescription medications.